Hi, my name is Michelle Harrell. I'm an associate professor at Montgomery College. I teach medical surgical nursing too, and I also teach the transition to nursing program, which includes paramedics, medics, and LPNs. I also teach health assessment, which is a first semester course that teaches the basics of what a nurse will need to know in order to effectively care for patients in the community. Today I'm going to talk a little bit about the American Disability Act, and I'm going to talk about students with disabilities that apply to the nursing program and must be effectively educated so that they will be able to successfully take care of patients in the community. I would like to urge you to please consider the following. What are you as a faculty member? What are your perspectives of students with disabilities? What do you think students with disabilities perspective on their experiences in the nursing program are going to be? And what are their expectations for accommodations based on the laws that are available that protect them? And I also want to think about your nursing education. Do you take any continuing education classes that helps you be sensitive to what the needs are of students with disabilities? And also education classes that might help you develop reasonable accommodations for students that have learning disabilities that might present in classes such as health assessment and also in the clinical area and in simulations and lab skills. I would also want to think about what are your general accommodation perspectives so far as accommodating students that have disabilities, and what are the disability legislations that we as educators must adhere to in order to remain compliant with laws and regulations for the state in which you teach. So we all know that a learning disability can pose a sizable academic and clinical performance obstacle for the students involved, and that can be a huge stressor as they come in to learn an already difficult program. They also have to overcome their disability in order to be successful. Therefore, we as faculty members must be ready and willing to accommodate these students in the best way that we can so that they're able to be successful. Disability is becoming something that is no longer a barrier for students that wish to pursue their nursing education. And as such, we must be prepared to meet the needs of these students that present into our nursing programs. So some of the issues that you as a nursing faculty needs to think about even before the student presents for simulation are issues such as acceptance into the program. And if we are accepting a student with a disability into the program, what are some things that we need to think about? So many nursing programs accept students based on standards that will be required for them to be successful in the program. These standards include critical thinking, which is are they able to make sufficient clinical judgment? Interpersonal ability, are they able to sufficiently interact with individuals, families, and groups for a variety of social, emotional, cultural, and intellectual backgrounds? Are they able to communicate? Because it'll be important for our students to be able to communicate sufficiently so that they're able to provide competent care. And mobility, if it's a student with a disability, is the physical disability something that we can reasonably accommodate them so that they are able to move from room to room and maneuver small places? And especially in the patient care rooms, we need to be able to ensure that that student is going to be able to be safe to care for that patient, and the students themselves is going to be able to use their accommodation in a way that they can safely maneuver without getting injured. Their motor skills, we need to think about gross and fine motor ability to provide safe and effective nursing care. Hearing, auditory ability, is it sufficient to monitor and assess healthcare needs of the patient population? By this I mean, are they able to hear an alarm that's going off? Emergency signals such as a code blue or a rapid response, or just the telemetry monitor alarming, or the bed alarming for an elderly patient that might be confused and getting ready to fall. Cries for help, if maybe a patient is screaming or calling for someone to help them, are they able to be accommodated in a way that they'll be able to hear that patient call? And then visual ability, is it sufficient to observe any clinical changes that might be happening to the patient? And tactile, are they able to sufficiently perform a physical assessment to where they're able to deliver effective care for that patient? So the most prevalent disability that we are seeing in the nursing programs is dyslexia or learning disabilities. Those are the highly occurring learning disabilities. But it's been closely followed by students that have hearing and visual impaired. Those students are appearing into the program. Now, for students with hearing disability, there are certain things that you can do as a faculty member in preparation for simulation for the student. One thing is that you need to work very closely with your DSS office, that is the Disability Support Office, that is able to link students with a counselor that will help monitor what their needs are and their concerns, and might also be able to find resources in the community that might be able to get, for example, a hearing impaired student might need an amplified stethoscope that might be very expensive and out of their reach. Then there are funds that might also be available to buy equipment, perhaps to provide the student with a translator that will be able to do some sign language interpretation. And this person would need to have some baseline understanding of the class that you're teaching. I have had a student that was able to successfully navigate the health assessment class and actually perform very well. So it's very important that as a faculty member, you assess what your biases are prior to a student coming into your classroom. And once you assess your biases, you need to find some professional development to help you understand what the challenges are that this student might be facing, and what you as a faculty member should do in order to ensure that the student is educated in an effective and equitable way. If it's a student that has a visual impairment, you need to get with your disability office again and try and find out what resources are available out there to help with the vision, and how can you as a faculty member again get professional development to help you navigate any challenges that you might face. Some things that you might be able to do for a deaf student would include the amplified stethoscope. You might also want to have some one-on-one time just to meet with the students with any disability, just to go over what their accommodations are that have been provided by the disability office. It is important that you have this one-on-one connection with the student so that you can anticipate any challenges that the student might project themselves to have, and you find a plan that will work for the student so that they are able to maximize their educational experience. One of the other things that I find beneficial in simulation is also to ensure that a student that has a disability is comfortable with participating in the role that you project you might be able to give to them. Now, there's different school of thought. Some faculty members might think that that is treating the student special, but remember that this student is already overcoming a significant disability, and you don't want to put a deaf student in the position, for example, of the lead RN if they are going to have their back turned and the secondary nurse is going to be trying to speak to them and they can't hear what is being said. It'll also prove a distractor for the rest of the students if this student cannot be accommodated effectively enough to where they listen via their hearing aid, and then they have to visualize the translator or the sign language interpreter that's interpreting what's being said. And then they also have to navigate use of equipment such as a high fidelity mannequin. So these are things that you need to discuss with a student prior to the simulation experience. And when you're orienting the students to the simulation room, you want to make sure that with your student with disability, you provide extra orientation so that they are truly comfortable with everything and that is placed in the room, so that they can effectively communicate with the patient, should it be a standardized patient, or they are also able to effectively hear the prompts that are being given by whoever's running the simulation. Educating a student with a disability can be a very rewarding experience because a lot of students are able to academically be successful if nursing faculty are open-minded and provide an opportunity for them to be integrated into the standard nursing education. You will learn a lot about yourself, while you'll also learn a lot about the community that you're educating, be it the blind or the deaf, or even if it's a student with an impaired mobility. The learning disability such as dyslexia is also another area where you as a faculty member need to be aware that even though it's not a visible disability that you can easily see, it is a disability that requires you to be conscientious and give instructions in a way that that student can be successful. I hope that this Sim Talk is helpful to you and that you will take time to maybe read some articles about educating students with disability. And as we continue to grow as a science, I hope that nursing will be open-minded to continue to integrate students with disability into their curriculum. Thank you so much for your attention and have a great day.